Folks, Russ Scala here. Today we're going to talk about the ketogenic diet and prostate cancer. Remember I told you a few videos back that people are going to empower themselves to ask the tough questions. People are going to empower themselves with research. Well, I got my buddy here today, Hank Cosner, and his story is amazing. Listen to it, learn from it, and listen to what Hank did over a period of a couple years, okay? Hank, you're going to educate a bunch of people, man. Tell us your story, brother.
Well, you know, I was diagnosed with prostate cancer about 8 years ago. And without going into too much detail, my situation did require surgery and some radiation to stop it because it was somewhat advanced, which worked. If you remember back then, I got together with you. We ran some blood work. I started doing glutathione and B vitamin shots, started using some of the dietary suggestions that you made, and I chose not to go on the heavier medication that they wanted me to go on.
Okay.
I took a lighter medication, and for 7 years I was in pretty good shape. But there was a noted rise then in my blood work. It showed that the cancer was trying to come back.
Now you had your PSA removed, your prostate removed.
Yes, yes.
So that's good. You had your prostate removed and the PSA levels went back up. That's very interesting, folks. Well, listen in.
Because of how the cancer was situated in the prostate, it compromised the capsule. So it did get out into my system.
Okay.
After the surgery, all my margins were clear. My blood work never, you know, once you have your prostate out, you should have a 0 PSA.
Right.
My blood work never completely zeroed out, but we were able to control it under 0.1 for a long, long time.
Amazing.
Well, it started to rise, and then this is where it comes in where you have to educate yourself. There's a lot of information out there about the different courses you can take in your treatment. So what I did was I was with a good doctor, and he was a good manager, and he was always impressed when I went in to talk to him. I knew as much as he did.
Well, see,
he almost didn't have to, you know, I would go in and say, well, there's this, this, and this, and what's the best course of action? Should we, you know, and we would discuss it.
And that's not being arrogant. That's just being honest. The doctor's got to see 40, 30 people a day. You said you went in there and you knew as much as he did, and what I like about this doctor is he was opened,
right.
And you guys worked as a team. See, folks, that's going to be the future of medicine. No more are we going to just sit there and listen to the doctor and do whatever he says. You're going to be working as a team now. This is what's so exciting.
So what happened was my PSA started to rise, but it was what they considered with normal limits. This is where I should have been myself. I should have been a little bit more inquisitive. Because as the levels started to rise, it would indicate that I'm having a recurrence. Then I had a big jump. Then I had a jump up to 3.3, then to 5.6. Well, when I was easing up to 3.3, we should have done some scans, but we didn't. He assured me that we were still good. I had decided to take Eligard or Lupron shots, which castrates you chemically. It shuts down your testosterone production. So, which brought my numbers back down. So there were other indicators. He was managing me at that point, and when I had the 5.6, I went in and had scans and found out that the cancer had metastasized to my bone, but only in one place, in my sternum.
Interesting.
One spot.
Okay.
At that time, you know, he said, well, you know, we'll put you on the Zytiga, which is a medicine designed to suppress that, and we'll just monitor you. It wasn't good enough for me. I didn't think that that was an aggressive enough treatment, so I sought a second opinion. I did research, talked to people in the college, and I found I switched to another clinic it's a teaching hospital. That's involved with the University of Florida. It's better to be with a medical center that's involved with a teaching hospital because they seem to be a little bit more on the cutting edge.
And they're doing research.
Right. So once again, I went in with my, and I had a second opinion with this physician, and he was fantastic.
Nice.
He knew He was able to talk to me about my situation. He showed me things in my blood work that should have been spotted a year ago.
Wow.
That may have indicated I was going to go into to have another situation. So anyway, couldn't go back, right? So we started from there. So we did a combination of the therapy he suggested and the medication he suggested, and that's when I decided to, with all the research that I knew, I had gone through a couple of years where I really wasn't doing what I should have been doing dietarily,
right,
and physically on my own. I was kind of riding the wave, and I realized that maybe mentally I was a little depressed and I was using food to satiate that, but I immediately switched gears. I did my research, went on the ketogenic diet. I went on what I consider a more extreme version of it that helps to fight cancer.
and we had dialogue about
Right,
that.
right.
Yeah.
And in 3 months, we did some very, very mild radiation on the spot, because the research shows that if you have one spot, we did the scans, there was no other cancer in my body except for this one spot.
Wow.
So what we did was we focused on that spot. Low doses of radiation, the oral medication, and then the ketogenic diet. When I went back to have my blood work done, it went from 5.6 to 0.26.
Wow.
The doctors said that that was miraculous. They expected to see a drop. They didn't expect to see a drop like that, because normally, under normal circumstances, a normal person with prostate cancer with a normal diet won't get that kind of a drop.
Well, a lot of these guys, as you know, don't know that cancer feeds in a high glucose environment, and the ketogenic diet is affecting you on a cellular level. Right. Your mitochondria is using fat, beta-hydroxybutyrate, more efficiently, and you did that, and man, I just, that's going to give people so much hope, man.
And there's there's more to it. You have to do your research. You have to counteract the medication. The other thing that's really important, and all the research is showing this now, and there's a lot of stuff, they're starting at places like Sloan Kettering and at Harvard University and Moffitt. They're looking at ketogenic diet for cancer patients. They're also looking at the next phase of that is, I don't want to go into a big long, maybe sometime I can talk about how I approached the ketogenic diet. I looked at it as from the perspective of my cancer.
Right.
What can I do? How can I change it to make it better?
Well, you lost a lot of weight too.
Right, which under a ketogenic diet, you're going to lose that weight.
Yeah.
Even people who don't have prostate cancer, who want to lose weight, this is the best way to do it.
You know, the perfect storm, you know, when you're heavy, you have inflammation. So the new research that I put together, which you and I always talk about, Hank is wicked smart. So we know the new research, if you think about it, for prostate cancer that the doctors aren't looking at, is elevated estrogen causes cell proliferation.
Right.
Something called IGF-1, when it's elevated on the standard American diet, elevates cells to grow. Insulin is a growth hormone. High blood sugar causes oxidative stress, and we measure something on the cellular level called 8-hydroxy-2-deoxyguanosine. That's a big word to say, and there's DNA damage that could cause mutations. Well, for a lot of people, when their PSA goes up, doctors want to do, they want to do a biopsy, and that biopsy can actually cause mutations. So the whole paradigm shift in prostate detection, they're not even doing PSA testing anymore. They're doing ultrasound. So the whole paradigm shift in prostate cancer is changing, and it seems like you've been on the tip of the spear with a lot of the dialogue we've been having.
Yeah. Inflammation is everything. You must create the human body is normally in an anti-inflammatory situation. Nice. Until it needs to be if you injure yourself or there's an issue somewhere. Right. But in the Western diet and in the normal American diet, we increase inflammation by having high levels of processed foods, all the sugar, the hidden sugar that's in there, and processed fats.
Omega-3 and omega-6 imbalances cause inflammation. Right. If you're heavy, folks, and carrying a lot of extra weight, your body will be in a pro-inflammatory response, elevating something called pro-inflammatory cytokines, these little enzymes in your body that could damage tissue. So again, this is multifactorial, and it's just amazing what Hank did on his own here. It's truly amazing.
There's a way to control this, to use the diet. And then once, like I said, I used a pretty rigid form of it. And I've lightened up a little bit now and added a few more foods, but still, I remain in ketosis. The diet is focused on where I'm at right now. And then the next phase would be to start restricting your calories. In the beginning, in order so you don't kind of fall off the wagon and want, other foods. If you're gonna, you can eat larger amounts. For instance, if you're gonna have chicken, eat a bunch of chicken and have some asparagus. Eat enough to fill yourself up.
Right.
But the diet takes all those cravings away over time.
Right.
You can eat less. Then the idea too is to restrict calorie and start thinking about doing some intermediate fasting.
Right.
And that also helps because even now at Sloan Kettering, they're really looking at having people fast while they're on chemo.
Yeah, that's a hot topic.
Right.
Tom
Because
Siegfried,
the chemo is actually more effective when you're fasting.
And if you're on the ketogenic diet, you're doing intermittent fasting, and your insulin and blood sugar is low, then you can use less chemo with less damage to the body. That's amazing.
Right. So that's my story. That's what I've done. Now in like 2 or 3 weeks, I'll have my blood checked again. My goal is, and I would like to be able to accomplish this, is to eventually, if I can get my PSA to completely zero out, meaning my body is now in control of the cancer or is in the process of eliminating it. If I go 2 cycles that way, I'm gonna take myself off the medication.
Wow.
So I need, it's 3 to 6 more months, but that's my goal, is to see if I can get to that point and then try to remove myself from the medication. Maybe this is a way ultimately to help cure the cancer. I don't know that yet, but I'm mixing the best that Western medicine has with the best research that I have at my fingertips to create a program that I think has put me back in remission.
No, it has. And, your story is going to help so many people out there. Thanks so much for sharing this and the continued dialogue that we had, my man. Folks, remember, come to the Russ Scala YouTube channel, get educated, ask the tough questions, raise your doctor to a higher standard, and be safe.
Everybody and everybody has a story. Let us find out yours today.